Good afternoon, everybody. Welcome back to American Safety Programs and Training for our chapter review of Chapter 17, Neurological Emergencies. Now, the previous two chapters we talked about 2 chapters ago. Chapter 15, I believe we ended up talking about respiratory emergencies. Chapter 16, we ended up talking about cardiovascular emergencies. Now we're getting ready to talk about neurological emergencies. Respiratory emergencies, as you remember, refers to the lungs and everything that takes place in the lungs and how they work and what they do for us. Cardiovascular emergencies refers to the heart, the myocardium, how it works, the blood flow through it, the importance of it, because without it we can't live, how it works, and what goes wrong with it, and what we can do as EMTs to either stabilize, stop it, and get the patient to the hospital. Neurological emergencies refers to the brain and everything that goes on in the brain. Okay, we're going to discuss the anatomy of the brain, the physiological aspects of the brain, different parts of the brain, the 3 sections, what each section does. We're going to discuss stroke, seizures, and altered mental status in this chapter. We're going to talk about what stroke is, the different types of stroke, what are seizures, what are the different types of seizures, and what is altered mental status, and does or does not altered mental status affect or is affected by stroke and or seizures. So let's go ahead and begin. I'm going to try to go off of the book and the PowerPoints and my general knowledge and some notes that I took, so hopefully I won't confuse anybody with what I'm saying and what I'm showing on the PowerPoints. So, to begin with, stroke. Stroke is the 5th leading cause of death in the U.S. And it is the leading cause of adult disability in the United States. The reason being is because stroke affects the brain. The brain affects all parts of our body. And for those of you who might know, you might not know this, the brain is broken down into the left side and the right side. Okay? The left side of the brain controls everything on the left side of the body, and the left side of the brain controls everything on our right side of the body. But also there are parts of the brain, the front, the middle, the back, and the 3 sections of it that controls specific aspects of our body. Okay? Strokes are very, very common in geriatric patients. Geriatric patient is referring to the elderly population. The most common type of stroke is the one where there's a blockage up in the brain because there's a blockage of an artery, and because there's a blockage, whatever's beyond that blockage, whatever brain tissue is past that blockage, it's not getting the blood, so they have a stroke. There's poor perfusion. If you guys remember what perfusion is, the adequate supply of oxygen, blood, and nutrients and vitamins to the tissues and organs of the body. Well, if you have a blockage in the heart, that does what? That causes myocardium to start to hurt. It can hurt. It can die if it doesn't get the blockage removed fairly quickly, and the myocardium or parts of it starts to die, and that can put you into a heart attack, which can then lead to cardiac arrest. A stroke is when you've got a blockage up in the brain, and brain tissue is affected. Okay? So we're going to describe the different types of seizures, of partial seizures, the status epilepticus, and how they affect the human body and the brain. Okay? So we know that stroke is the 5th leading cause of death in the U.S., and it's the leading reason why adults have a disability, because when you have a stroke, it affects your brain, which affects your bodily functions. What are some of the contributing factors of stroke? New treatments are available for stroke every single day. But nothing can beat the early recognition of possible stroke, or somebody is having a stroke. You identify it and you notify 911 right away, and you start immediate treatment. Even if your treatment as a layperson is very, very minor, rolling them over so they're not choking if they're vomiting or anything like that, or making sure that their airway is breathing, that can make a huge difference. That little thing, that little step can determine whether that person will or will not survive that stroke that they're having right now. So, with that said, sorry, I just forgot to set my timer here. Okay, so contributing factors of stroke. We're going to discuss that as well. A lot of factors, a lot of things contribute to having a stroke. Seizures and altered mental status are other common neurological emergencies that we're going to discuss. Anatomy and physiology. The brain is the body's computer. It controls our breathing, speech, and all of our other bodily functions. Okay, there are three major parts of the brain. There's the brainstem, the cerebellum, and the cerebrium. Okay, but before we get into the brain, this section, let's discuss a little bit. Let's discuss some other things very shortly. African Americans, Hispanics, and Asians are at a higher risk to have a stroke. I don't know all the reasons. I know that the general consensus and all the medical tracking that has taken place is that those individuals from those backgrounds tend to have stroke more frequently, most likely because it's hereditary. They're born with it. It's genetic. Why, I don't know. Okay? Two things can equal a good outcome for the patient, and that is dedicated stroke centers and time. If someone's having a stroke, you're not going to take them to their doctor's office. If someone's having a stroke, you're going to want to take them to the hospital. Now, in Rhode Island, we have numerous hospitals. They all can handle patients for stroke, but there are certain hospitals who have more experience dealing with stroke patients, and that experience is probably because of the population that lives around the hospital. For example, Merriam and Rhode Island Hospital. Okay, those are two very, very good stroke centers in the state of Rhode Island. So you can get to them, and they usually have more staff. A higher degree of the staff has more specialties than the smaller hospitals. And I'm not saying the hospitals can't give. I'm not saying the hospitals cannot give or do not give outstanding treatment to those individuals having stroke. But the larger hospitals have more manpower, they have more money, and they can afford to buy fancy equipment, and afford to pay for the more experienced doctors to come and work at their hospitals. In time, again, it goes back to what I said: recognizing the possible signs and symptoms of a stroke, and activating that 911 system, getting the person en route to the hospital, and start treating them right away. Those two things combined can equal a good outcome for the patient. Okay? So, I said that neurological emergencies refers to the brain, which is true. This is talking about three parts of the brain. Okay? We're talking about the cerebrium, the brainstem, and the cerebellum. Okay? The cerebrium is the largest part, and that's the one that's broken down. If you look up there, okay, that is the largest part of the brain. Okay, that's broken down into the left and right hemisphere. Now, you've got the front portion of the cerebrium, you've got the middle, and you've got the back portion. The front portion is up here, the middle is right here, and the back is back here. So, let's discuss the front. The front part of the cerebrium controls emotion and thoughts. The middle of the cerebrium controls sensation and movement of our body. It controls our ability to feel and touch in our movement. And then the back controls our sight. Okay? I keep doing that. Sorry about that. The back controls our sight. And if you consider it, you've got the eyes that are right about here, and you have the optic nerve that comes back and it goes into the brain, and that's how we can see. And what do you know? It right back here, the back portion of the brain controls sight. Okay? Then we have the cerebellum. The cerebellum's down here in the bottom part. It's basically like stuck in between the spinal cord and the bottom of the brain. Okay, or it's underneath the cerebrum. The cerebellum. The cerebellum controls muscle and body coordination, complex tasks such as walking, writing, playing the piano, standing on one foot while keeping yourself balanced and standing, picking up a penny, throwing things, coordinating things. Okay, that's the cerebellum. And then we've got the brainstem. The brainstem, as you can see, I'm going to do it again. The brainstem, as you can see, goes over here into the middle, then it goes up to that portion right there, and it goes down right to here. It's basically the top portion of the spinal cord, the tip of the spinal cord, about an inch or two of the spinal cord. I don't know exactly how long it is, but that's basically the brainstem. The brainstem controls most basic bodily functions such as breathing, blood pressure, swallowing, and our pupil constriction. Okay? And then you've got the spinal cord. And the spinal cord goes down through the back, through the 33 vertebrae that we have in our neck and our chest. Okay? One thing that the cerebrum does is that it basically on the left side of the cerebrum and about in the middle is where speech is controlled. Okay? So the brain works. It's a computer. And it sends and receives messages to the entire body. That we know. Okay? The brain has all these wires. They're called nerves. And they go all over the head. They go all over the body. So how do they get out of the head? How do they go down to the body? How are they distributed around the body? Well, in the brain, you have 12 cranial nerves. You have 12 cranial nerves that remain in the head. And they go to the skin, the nose, the mouth, the chin, the ears. Everything that's in the head, those 12 cranial nerves go to. Okay? Then you have the large opening in the back of the brain, which is right about here, back bottom of the skull. Okay? And if you've ever seen the skull, that's where the spinal column goes in or connects to the skull. Okay? That is called the foramen magnum. The foramen magnum. And that's the hole that's in the bottom of the skull. And that is where the spinal cord exits the skull, goes down the spinal cord, and that is where the spinal goes down through the backbone, the back, the cervical spine, and that is where the spinal cord or the cervical spine connects to the skull. Okay? At that point, nerves start coming down from the head, down the spinal column, and at every vertebrae, you have 2 spinal nerves that branch out of the vertebrae. At every single vertebrae, you have 2 spinal. One goes to the left, one goes to the right. Okay? Spinal cord. What can you guys remember about the spinal cord? The spinal cord has 33 bones. Those bones are called vertebrae. Those 33 vertebrae are what? They're broken down into how many sections? 4, 5, 6, 7 sections? They're broken down into 5 sections. 5 sections. 7, the top is called the cervical. That's 7 vertebrae. Then you've got the chest area, which is known as the thoracic. That consists of 12. Then you got the lower back, which is called the lumbar, and that has 5. Then you have underneath or below the lumbar, below the lower back is called the sacrum, and that has 5. And last but not least, the very bottom, they call the coccyx, and that's 4. So you've got cervical, thoracic, lumbar, sacrum, and coccyx. That gives you 7, 12, 5, 5, and 4. And the coccyx is what they used to call, or what some people call the old human tail when mankind used to be monkeys or apes way in the back in the ages of early development, and that's where we had our tail. But those last 4 bones are fused together. Technically, they form one bone, but they are still individualized. So you have 4 down there. Okay? So, anatomy and physiology. The brainstem controls most basic functions. The cerebellum controls muscle and body coordination. Anatomy and physiology. Messages sent to and from the brain through nerves. You have 12 cranial nerves, and then you have your spinal nerves. And there we go. Right there. Okay? You got the foramen magnum, which is right here. Okay? Opens up, and the brainstem comes down. And all the spinal, and see how it branches off? At each vertebrae, each one of those 33 vertebrae, 2 nerves come out, one on the left, one on the right. And then as it goes out, it then further breaks down into smaller nerves that are distributed through that section of the body. And then you have your spinal nerves right there. See how they break down? Okay? Many different disorders can cause the brain to malfunction or to dysfunction. And the brain is very sensitive to changes in oxygen, glucose, which is sugar, otherwise known as fuel for the body, and temperature changes. Okay, the disorders that can cause brain dysfunction can affect the patient's level of consciousness, speech, and voluntary muscle control. And when the body is having a hard time dealing with too much or too little oxygen, too much or too little sugar, or the temperature is too high or too low, it can significantly change any one of these, which will result, or any significant change in any of those 3 will have a major neurological change. Okay? So, what are some of the things that can affect the brain? We talked about the brain, we talked about the 3 parts, what each part does. Okay, we talked about the cranial nerves, the foramen magnum. We talked about the vertebrae in the back, how you get the spinal nerves. The nerves come out of every single one of those. And how the brain is very sensitive to oxygen, glucose, and temperature changes. Okay? Well, we all know what a headache is, right? We have mild headaches, we have painful headaches. We have migraine headaches. Headaches can be broken down into basically 3 separate categories. Tension headaches, migraine headaches, and sinus headaches. Great test questions, everybody. Those three are the most common types of headaches that people have, and they are not life-threatening. Okay? A tension headache is basically when you have tension in the back of your neck and the back of your head. It's caused by muscle contractions in the back of the head and the neck. A migraine headache. Migraines are thought to be caused by the sudden dilatation and the constriction of the blood vessels in the brain. Women are 3 times more likely to have migraines than men. I know a lot of times women say, men give them headaches. Well, I can understand that. I believe it. Okay. And then sinus headaches. It's increased pressure in the sinuses. Got less stuff clogged up in there. Okay? But when you have a patient and they're calling 911 for a severe onset of a headache, if they don't have any history of anything related to headaches, any type of past medical history that headaches are a part of, and all of a sudden this person is complaining, especially an elderly person, if they're complaining of a severe onset, otherwise known as an acute, which means very quickly, came out of the blue nowhere. Just 1 minute they're sitting down, next minute, boom, they're having the worst headache that they've ever had in their life, and it's really, really bad. They've got an acute, severe onset of a severe headache, excruciating pain, and some of the signs and symptoms that go along with it: nausea, blurred vision, irritability, discomfort, raised respiration because of the pain level. You want to consider that person. You may not know what's going on. You may think, oh, he's got a really, really bad headache. It could be something else, and we'll discuss that. But anybody who's complaining of an acute, severe headache with severe pain, they don't have any history, you need to consider that person as a priority patient, and they need to be transported to the hospital as quickly as possible, because they need to be evaluated by doctors and surgeons to determine, could they be having a stroke, could they be having a seizure, or is there something more severe going on? But to have a severe headache come out of the blue within a matter of minutes is not normal. Okay? So, if you want to take a look at page 677, page 17-1, you're going to have headaches, red signs, or red flags. Okay, a patient who has a headache associated with any of the following should be evaluated for potentially life-threatening condition. A sudden onset of symptoms, explosive, thunderclap pain. They have altered mental status. They're over 50 years of age. Okay? They have neurological deficits. They can't open their eyes. They can't lift their hands up. They have extremely stiff pain in the neck. They might have a fever. They might have changes in vision. Or they might have paralysis, the inability to move, or weakness on one side of the body. Okay? Those are red flags that something serious is going on in the person's head, or something's going on in the person. And we know it's the head, the brain, because that's where the complaint that your cheek pain is coming from. Okay? So, let's talk about strokes now. Okay, we talked about the brain a little bit, discussed things, the makeup of the brain, spinal nerves, and everything. So let's talk about stroke. Okay? We're going to talk about in this chapter strokes, seizures, and altered mental status. So number 1, stroke. What is a stroke? A stroke is defined as an interruption of blood flow to an area of the brain tissue, resulting in the loss of brain function. So the part of the brain that is not getting proper blood flow, if you guys remember this from chapter 15, when we were talking about respiratory emergencies, or chapter 16, cardiovascular, there's something that's called perfusion. Okay, perfusion is the adequate supply of oxygen, minerals, and vitamins, and the removal of waste to all the tissues and organs in the body. Okay, if you have poor perfusion, that's going to send you into shock. If you have poor perfusion, that means you're not getting blood flow and you're not getting the oxygen to certain parts of the body. That part of the body, in this case, the brain, is going to get mad. And that tissue is going to start dying because it's not getting the oxygen and the blood and the food that it needs. So when that starts to happen, your head's going to hurt, or it's going to give you, you're going to start acting weird. Okay? When you have a stroke, ischemia can occur. Okay, ischemia, I-S-C-H-E-M-I-A, is in your book, is when oxygen-deprived tissue has poor perfusion occurring that can result in temporary or permanent tissue damage or death. So ischemia is oxygen-deprived tissue due to poor perfusion that can result in temporary or permanent brain or tissue damage or death. And once the tissue dies, it doesn't come back. Okay? So, let's talk about the 2 different types of stroke. Let's see if they can have them here. Okay, headaches is a very common complaint we're going to deal with out in the field. Where's my pointer here? Where is it? Okay. I apologize, everybody. Headache. One of the most common complaints that we deal with can be a symptom of another condition or a neurological condition on its own, and it's only a small percentage of headaches are caused by serious medical conditions. Headache. There's a tension headache caused by muscle contractions in the head and neck. It can be attributed to increased stress in your life. You have a really, really bad day, bad relationship, something's going on. The pain is usually described as squeezing, dull, or as a throbbing ache, and usually does not require medical attention. Okay? You don't need to go to the hospital for a tension headache. Then you have migraines, thought to be caused by changes in the blood vessels and the sizes in the base of the brain. Pain is usually described as pounding, throbbing, and pulsating. It's often associated with nausea and vomiting are some of the signs and symptoms, and can also include visual changes, things become blurry, and it can last for several hours or several days. I'm sure you all have heard or know somebody who has migraines every once in a while. Some people they're really, really bad, to the point where they just need to be left alone. They need to go into a dark room where it's absolutely quiet, no noise, no light. Okay? And sinus headaches, caused by increased pressure from accumulation of fluids in the sinuses. And there we go. Table 17-1. Headache red flags. Sudden onset of symptoms, explosive thunderclap of pain. They have altered mental status. They're above age 50. They have depressed immune system. They have pre-existing neurological deficits. They have stiff neck and pain. They have increased fever, changes in vision, and one side of the body paralysis where they can't move anything, or weakness. A stroke. A stroke is also called a CVA. A CVA is also known as a cerebrovascular accident. Okay? Interruption of blood flow to an area within the brain results in loss of brain function. You have two different types of stroke. You have ischemic stroke and you have hemorrhagic stroke. An ischemic stroke is the most common one. About 80% of all your stroke victims are going to have it. And it's usually caused by a buildup of cholesterol and plaque in the arteries and veins. And that's called arteriosclerosis. You have something called arteriosclerosis and arteriosclerosis. Arteriosclerosis is the buildup of plaque and cholesterol inside of the blood vessels. Arteriosclerosis is the arteries and veins lose their elasticity. They're like garden hoses. If you've ever turned on a garden hose and under low pressure and it stays the same diameter, but once you turn that hose up all the way and you kink the hose where water can't go out anymore, then you see that the hose, the diameter of the hose, it starts to swell just a little bit. Okay? That means that the plastic is elastic. It's able to get bigger and smaller. Well, arteriosclerosis doesn't let your veins and arteries stretch like that. They're just solid lead pipes now. Okay? And arteriosclerosis is like having a garden hose with a bunch of crap built up on the inside of it. And when you turn the water on, water and all this gunk comes out. Okay? That's arteriosclerosis. Like I said, that's about 80% of all the strokes that we deal with, and it's the most common one. Okay? An ischemic stroke is blocked or reduced blood flow to the cerebral arteries. Cerebral meaning the brain. The arteries supplying the brain. The arteries are blocked. When I talked to you guys about in the last chapter, occluded, blocked. Is it completely occluded? Is it completely blocked? Or is it just partially blocked? Otherwise known as partially occluded. Okay? Then you have, let's go this 100% results thrombosis emboli. Okay? So what's a thrombosis? And what's an embolus? A thrombosis is a clot formed at the site of the blockage. So let's say you have a clot. A clot is a blockage. A clot is that piece of junk that blocks something. Okay? The clot forms at the blockage site. So let's say if for some reason in your body you have an artery and it has so much buildup that the buildup gets more and more and more and more, and the blockage is basically blocking the artery right there. That's a thrombus. Okay? An embolus is a clot that is formed somewhere else in the body. It's usually the heart, and it breaks off, or a piece of it breaks off, and it travels up to the brain. Because if you remember from the last chapter, when blood comes out of the heart, it comes out through the aorta, correct? And then from the aorta, some of the blood goes up to the carotid arteries, up to the brain, and up to the head. Well, it travels up through the carotid arteries, up to the brain, and it gets stuck. It creates a blockage. And then the other blood goes to the subclavian, or the subclavicle arteries, to supply the upper extremities. And then you've got your aorta, which extends down your back, and it goes down through your iliac, down to and then splits to your femoral arteries and supplies the lower extremities. Okay? So you got the thrombus, which is when the clot forms at the site where the blockage actually is, and then you have the embolus, which is the clot is formed somewhere else in the body and it travels up to the brain. The majority of the time that clot is formed in the heart. And that clot is called a mural. It's a mural clot. The mural clot is or it is formed in the upper chambers of the heart, the atria, and it can also contribute to AFib. Okay? So, you got that taken care of. So right here, ischemic stroke. Where's my point? There we go. Ischemic stroke. You got the right carotid, the left carotid, it's coming up, coming up, coming up, boom. The clot forms right there, if you can see where the little thing is I got there. And all this area here is tissue dying or tissue being affected. Tissue that has poor perfusion. So this part of the brain, the right side of the brain, which controls the left side of the body, this person's going to start showing signs and symptoms of a possible stroke. Okay? Use another one here, clots up here. Clot origin from the diseased aortic valve comes up from the heart, comes up. Okay? Now, are there other clots that can be formed in the heart? Yes, but I just mentioned one of the clots, the mural, that is usually formed and that is formed in the atria. Okay? Or you can have hemorrhagic stroke. A hemorrhagic stroke is when that garden hose that's up in your brain and is delivering, if it's delivering blood to the brain, and a section of that wall of the artery gets weak and it bursts and it starts bleeding. It's a brain bleed. Okay, that's when you have a brain bleed. That's a hemorrhagic stroke, and that's because the blood vessel became weak and a portion of it blew up like a balloon and then it popped. And now you're bleeding in the brain. The hemorrhagic stroke accounts for about 13% of strokes that we deal with. Cerebral hemorrhages are often fatal because if it happens, depends on where it happens in the brain. There's a lot of times the hemorrhagic stroke can happen right smack in the middle of the brain, and the doctors can't get to it. They can't get to the bleed to get it to stop. So you're bleeding into your brain, and the pressure just builds up more and more and more, and it starts squeezing your brain because of the fluid is building up. Okay, just like when I told you guys start to have a fluid, which is blood or air, start building up in the pleural space of your lungs. Okay, and it starts to squeeze one of the lungs. Okay, causing you to have difficulty breathing. Same philosophy up here. You start to have a buildup of blood between the brain and the inside of the skull, and the blood just keeps coming out, but the body can't reabsorb it fast enough, so the pressure just builds and builds and builds. Okay? And that can and will kill you if it's not treated. And that's when a lot of times they'll go in and they'll cut away part of the skull to let the blood escape and to let the brain expand back to its normal size. And that, and then if they're able to fix the bleed, then they'll basically screw or strap the piece of skull back in place, and it'll heal itself. Okay. So let me see here. Hemorrhagic stroke. Let's see. When that blood vessel gets big, like down here in the red, that's what they call an aneurysm. An aneurysm is when you've got the blood vessel, just like the garden hose, and a section of it becomes very, very weak and starts to bulge out. That's called an aneurysm. And it's when the aneurysm breaks, that's when it turns into a brain bleed. That's when it turns into a hemorrhagic stroke. Okay? Let's see, let me make sure I'm not going to leave anything out on you guys. I don't want to confuse you. So hemorrhagic stroke, Barry aneurysms are a common cause of hemorrhagic stroke in healthy young people. It presents as the worst headache of their life, and it causes a subarachnoid hemorrhage. TIA, transient ischemic attack, okay, sometimes called a mini stroke, okay, is when a person exhibits the signs and symptoms of a real stroke, but the symptoms resolve themselves within 24 hours. They may have all the signs and symptoms of having a stroke, whether it's ischemic or hemorrhagic, but they call you and they tell you, well, the stroke, it started this morning at 9 o'clock, and it's 9 o'clock at night that they're telling you, but I'm beginning to feel a little bit better. Or it started a couple hours ago to the point where my wife finally decided to call 911, but I'm feeling a little bit better now. Okay? If you're having a hemorrhagic stroke or an ischemic stroke, it doesn't get better within a couple of hours. It gets worse. So when someone tells you they're not feeling good, it's a severe acute onset of a really bad headache, but then they start to go away, or someone is complaining of signs and symptoms of a stroke, but they're getting better. Their blurred vision is becoming back to them. They're not slurring their words as much. They've got better balance. They've got better posture than they did 2 hours ago. Chances are it's probably a TIA, but you still got to go to the hospital and get checked out. Okay? Signs and symptoms of a TIA, transient ischemic attack, can also be warning signs of a larger stroke to come and should be considered an emergency, though. Okay? It could tell you, it's like you're having a mini heart attack before the big one comes. In this case, you might be having a mini stroke before the big one comes. About 1/3 of the patients who have a TIA will experience a stroke soon after. Could be hours or days. And all patients with a TIA should be evaluated by a physician. Just because you think they're having a TIA does not mean that they need to go to the hospital. They called 911 for a reason. They called for you to come take them out, to check them out. Okay? If they are scared enough to call 911, then that means that they're scared. They think something's going on. So you take them to the hospital. Okay. Signs and symptoms of stroke. Signs and symptoms of a stroke. Tons of them. Before I discuss this, I just want to make sure we do this. Signs and symptoms of a stroke. Signs and symptoms of a stroke. You might have heard something called FAST. F-A-S-T. That's face, arm, speech, and time. It's used in all the hospitals. It's a very quick evaluation that medical personnel can give a patient who's in the hospital, that they can determine very quickly if this person is experiencing a stroke. If they don't pass all this, then chances are they're probably having a stroke. And strokes happen a lot in the hospitals. Face, arm, speech, and time. Face. Is their face drooping? Is one side of the face going down, the other side's normal? Arm weakness on one side. Can they take their arms, close their eyes, and hold their arms out in front of them, either palms up, palms down, in a fist or without a fist, and then can they keep the arms level? Can they elevate the arms at chest level and hold them out? Usually if someone's experiencing a stroke, one or both arms will just slide down. Speech. Are they slurred speech? Sort of like they're drunk and they're intoxicated. Not baby talk, but they're slurring their words. And 2, time. When was the last time the person was seen normal? Acting normal. Was it last night? Was it an hour ago? And the one reason why it's important to find out when was the last time a person was seen acting normal was because of the fact that there are certain procedures, mechanical or medicine, that can be 2 interventions that can be done on a patient within a certain amount of time frame that greatly enhances their chances of having a full recovery from the stroke, if they're actually having one, with little to no after effects. Okay, some of the other signs and symptoms of a stroke: confusion, they get dizzy, they get very combative, their restlessness because they don't understand what's going on, or they can go to a coma. Okay, they can have blurred vision, they have loss of muscle coordination, they can have speech disorders like they're slurring their words, difficulty swallowing. Okay, they have a decreased they have a decreased level of consciousness. Okay, they don't know where they are, they can't remember their name. They don't know where they are. They don't know if it's daytime or nighttime. They can't remember what month it is. Okay? And they're stating that they have a sudden or an acute onset of a really, really bad headache. One of the worst headaches they've ever experienced in their lives. Okay? Decreased signs of lack of muscle coordination, ataxia. Lack of muscle coordination called ataxia or loss of balance, and sudden vision or loss in one eye, blurred or double vision. Difficulty swallowing, decreased level of responsiveness. It takes them forever to answer a question. When they do, they're not making any sense. That would go down to speech disorders. Difficulty expressing thoughts or inability to use the right words. Slurred speech, dysphagia, and sudden severe headache. Okay? Confusion, dizziness, weakness, combativeness, restlessness, tongue deviation. If they stick their tongue out, say smile for me, and they smile, and one side droops down to the left, and say stick your tongue out, and they stick their tongue out, they think they're sticking it out straight, but it's going to one side, or they can't stick out all the way. Okay? Left hemisphere. Stroke in the left cerebral hemisphere may cause aphasia, which is the inability to produce or understand speech. Strokes that affect the left side of the brain can also cause paralysis to the right side of the body, Remember, the left side of the brain controls the right side of the body, the right side of the brain controls the left side of the body. Okay? Left hemisphere, remember that. Right hemisphere. Strokes that affect the right side of the brain can cause paralysis to the left side of the body. Patients can understand language and speak, but their words may be slurred. Patients may be oblivious to any problem that they have. They're having a stroke or they had a stroke, and the person you show up on scene is like, no, I'm fine. I'm cool. I just got really lightheaded for a minute. Someone will say, well, Joe, we were trying to talk to you, and you're talking like a baby, man. You're talking like you were drunk. And I'll say, no, I wasn't. I was fine. Okay? The patients with the problem affecting the back part of the cerebrum may neglect certain parts of their vision. And you say, oh, I've always had bad. That's why I wear glasses. But they don't want to say, for some reason, their vision seems a lot worse today than it did yesterday. Okay? And neglect and lack of pain cause many patients to delay seeking help. So if they ignore the pain, or they don't think the pain's that bad, they'll delay seeking help, if get any help at all. Brain bleed. Patients may have high blood pressure, may be to the cause of the bleeding, may be caused by the bleeding as a compensatory response. A trend of an increasing blood pressure is an important sign, and significant drops may occur as the patient's condition worsens. So, brain bleed, not good. Build up of pressure, that brain is getting squeezed, just like when the heart gets squeezed, heart can't function as well. Same thing with the brain. It's getting squeezed with all that blood surrounding it because it keeps bleeding and bleeding and bleeding. Body can't absorb it quick enough. So the brain's going to say, what the heck is going on? Okay? What are some of the reasons that the aneurysm started? And what actually caused the aneurysm to pop? Could be that the person has a history of high blood pressure over years of their life, and your arteries and veins can only take the pressure for so long. And it just so happens that one little section of the artery became weak, it became an aneurysm, it started ballooning out, and all of a sudden one day, say this person has high blood pressure, or say they really don't even realize it, and they're doing something extremely physical, and their blood pressure goes way up, and boom, it decides to pop that day. Okay, a trend of an increasing blood pressure is an important sign. The blood pressure will increase because now there's a leak, and the heart, which is the pump, the myocardium, has to pump more blood because the pressure is going down or up. Okay, now trending, if you guys remember, in the last 2 chapters, I discussed trending. When you take in a person's vital signs, their blood pressure may be, let's say, 120/80. And you take it again 15 minutes later, and now it's 140/100. And then you take it again 10 minutes later, and it's 148/118. So both numbers are going up. So they're trending upwards. But if the numbers were going down, the blood pressure was going down, then that would be trending going downwards. If the respirations, the normal respirations for a person is what? 12 to 20? So once you take the first set of vital signs on scene, you got a 30-minute ride to the hospital. Person's respirations are at 18 times a minute. You check the respirations 10, 15 minutes later, they're at 22. You check 5 minutes later, they're at 28. The respirations are trending upwards. Or, another bad scenario, when they're trending downwards. Okay? And the pulse, the pulse between 60 and 100. What if the pulse is going high or low? That's trending. So, any trending of an increasing blood pressure is an important sign. Significant drops may occur as the patient's condition worsens. Significant drops in vital signs, drops in their ability to speak. They were speaking to me 8 minutes ago. Now he can barely speak. Okay, he said the noise didn't bother him, but now we make the slightest noise in the back of the ambulance, and the siren's killing the guy. Okay, it's too loud for him. So, let's see. Mimic stroke. Stroke confusion. Okay. Conditions that may mimic a stroke: hypoglycemia, postictal state, subdural or epidural bleeding. Subdural means it's happening within the brain. Okay. is happening in the brain between the skull and the meninges. The meninges is a protective coating. It's like a bag that surrounds the brain and the spinal column. And if you have bleeding between the inside of the inside of the skull and the outside of the meninges, then you're going to have a subdural bleeding. Okay. If you have trauma to the head and you got a big bruise, they call that hematoma. You got bleeding in the brain, which is causing a subdural hematoma. Okay. Hypoglycemia, diabetics, low blood sugar, that could be causing it. Postictal state, a person has a seizure. And if you ever notice anybody who's ever had a seizure, after they have the seizure, then it seems like they're coming out of a really, really, really deep sleep. It takes like almost like 20 minutes for them to come back to being normal. That's called the postictal state. The body's recuperating from the seizure that they just had. Okay? So that basically covers the anatomy of the brain, the breakdown of the brain. Let me see here, what else? Before we start talking about seizures. Okay, so we talked about neurological emergencies can either be strokes, seizures, or altered mental status. We talked about how stroke is the 5th leading cause of death in the U.S., and it's also the leading reason why elderly patients have changes to their body, okay, that they have to go rehab for. A lot of the contributing factors of a stroke. They have a family history, their race, ethnicity, smoking, vaping. They have chronic high blood pressure. They have chronic high cholesterol. They're not taking the medication. They're not taking care of themselves. We discuss how the African Americans, Hispanics, and the Asian population are at a higher risk of having strokes. And we talked about how a person having a stroke, the two things that can really come close to guaranteeing a good outcome for a stroke patient is early recognition and quick transport to the hospital. There are two different types of things that we can do for a stroke patient. There's chemical interventions with drugs, and then there's manual interventions. The chemical interventions are called thrombolytic. Thrombolytic interventions are the chemical interventions we use if there's a stroke. Okay, if there's a blockage of if there's a blockage in the brain of an artery, if they catch it soon enough, they can actually inject a medicine into the blood that'll actually dissolve it like Drano, but it doesn't do any damage to the brain tissue at all. Or if they have to go in manually through the femoral artery, and they go right up with this long line with these little grabbers on the end of it, and they actually grab or suck the once they get it right next to the clot, they either grab it and pull it out, or they suck it up, and it goes in a little suction machine, and it comes out. Okay? So remember, chemical interventions for a stroke patient are called thrombolytic, and manual interventions for a stroke patient are called angioplasty. We talked about how the brain is broken down into 3 parts: the cerebrium, the cerebellum, and the brainstem. We talked how the cerebrium is the largest part of the brain. It's broken down in the left and right hemisphere. Speech is controlled on the middle left-hand side of the cerebrium. You've got the front, middle, and back end of the cerebrium. Okay, the front controls emotions and thoughts. The middle controls sensations and movements, and the back controls sights. We talked about the cerebellum, which controls muscle and body coordination, complex tasks like walking, writing, playing the piano, standing on one foot, picking up pennies, okay, stuff like that. And then the brainstem, which controls most basic bodily functions like our vitals: blood pressure, pulse, swallowing, pupil constriction, reaction. Okay? So the cerebrium is the main part of the brain. The cerebellum is the very back. It's almost like underneath the brain almost. And you got the brainstem, which is sort of like the very top portion of the spinal cord when it enters the skull. The spinal cord and the nerves, you got 12 cranial nerves that stay up in your head. The rest of the nerves exit the brain through the what? Through the foramen magnum. There's 12 cranial nerves in the head. Okay, and as the nerves come down the spinal cord, you have at every bone, which is called a vertebrae, you have 2 spinal nerves that come out, one on each side. how many bones do you have in the spinal cord? Or should I say how many vertebrae, because the bones in the back are called vertebrae. You have 33. They're broken into 5 separate sections. 7 of them are the cervical bones, or the cervical vertebrae. The next, thoracic, that has 12. Next is lumbar, that has 5. The next is the sacrum, which has 5. And then the last 4 are part of the coccyx. Okay? We talked about how altered mental status can be caused by many, many things. Blood clots, fever, illness, drugs, heavy alcohol use. Okay? We talked about how the brain is very susceptible to rapid changes in oxygen, glucose, and temperature. We talked about headaches, the 3 different types of headaches, the 3 most common headaches: the tension headache, the migraine headache, and the sinus headache. The tension headaches usually caused by muscle contractions in the back of the head and the neck. Migraine headaches are believed to be caused by the sudden dilations and reductions in the blood vessels in the brain, and how women are 3 times more likely to have migraines than guys. And sinus headaches are just basically increased pressure in the sinuses. Okay, we briefly touched about stroke, or CVA. Okay, a stroke is an interruption of blood flow to an area of the brain's tissue, resulting in loss of brain function. Okay, that's poor perfusion, and that can result in ischemia, which oxygen-deprived tissue due to poor perfusion with possible temporary or permanent tissue damage or death. We talked about the 2 different types of stroke. We talked about ischemic and hemorrhagic. Ischemic is a buildup of cholesterol and plaque inside the arteries that causes the blockage. And then we talk about hemorrhagic, which is where you have a burst blood vessel in the brain, which causes increased cranial pressure. Okay? Some of the causes of the hemorrhagic stroke can be increased increased blood pressure. You have high blood pressure all the time. You don't take care of yourself. You're in poor health. It could be medications you're taking. Sometimes medications can do things like that. They can weaken the walls of the arteries and veins. You get a trauma to the head from an accident, from a fall. You have excessive drug use, or you have a bleeding disorder. Okay? We talked about what the blood clot is for the ischemic. Okay? You got the thrombus and the embolus. The thrombosis, or the thrombus, is a clot that's formed at the site of the blockage, and the embolus is a clot that is formed somewhere else in the body, usually the heart, and it travels from the heart into the brain through the carotid arteries. And when that clot is formed in the heart, it's called a mural. Okay, which can also result in AFib. Okay, the hemorrhagic stroke can also be caused by an aneurysm, which is a weakening of the wall of the blood vessel, and then when that pops, you start to have internal bleeding in the brain. Okay, we talked about a TIA, a transient ischemic attack, which is when a person exhibits signs and symptoms of a stroke, but the symptoms resolve on their own within a 24-hour period. And we talked about a lot of the signs and symptoms of stroke: facial drooping, arm weakness on one side, the speech is slurred, they're confused, they're dizzy, they're combative, they're restlessness, they could be in a coma, they could have blurred vision, they could have lost coordination on one side or both sides. Speech disorders goes back to slurred speech. They have difficulty swallowing, decreased level of consciousness, and one of the big things is they're complaining of severe onset of really, really bad headache. Okay? So, that'll do it for part 1, chapter 17, neurological emergencies. Thank you very much. I gotta go take care of something, and then I'll be back and I'll start section 2, and only the section 2, no section 3, for chapter 17, neurological emergencies. Talk to you soon. Bye.